Well, the clock is ticking for anyone wanting to get the Pfizer booster or the vaccine. You have until the end of July to get inoculated with the Pfizer jab. This is because South Africa is now in possession of all the doses it actually ordered. And those doses have an expiration date of 31 July. From August, you still have the option of the Johnson & Johnson vaccine, and those only expire in 2023. So how has our vaccine rollout gone so far? Now, since April last year, we've received around 60 million vaccine doses, and that number includes both Pfizer and Johnson & Johnson. But have all these doses been allocated yet? Well, not quite. Of the Pfizer doses received, 66% of them have been dispensed, while only 42% of the J&J vaccines have been distributed. And of those distributed vials, over 90% have been physically administered to people. So all in all, just over 50% of the vaccines we've acquired have made it into people's arms. Now, in terms of boosters, only around 8% of fully vaxxed adults in the country have so far received a booster. And with over 12 million Pfizer doses expiring at the end of July, government has shortened the waiting period between doses as well as the period from full immunization to booster. With the number of fully vaccinated adults hovering at around 43%, the jab appeal continues. Now, with COVID-19 cases, hospitalizations and deaths remaining subdued, is South Africa ready for a similar easing of restrictions? The NCCC, the National Coronavirus Command Council, is meeting this week to decide the fate of the national state of disaster. Winter is around the corner and the possibility of another wave lurks, so a cautious approach is likely to be applied here. Just what would your new normal actually look like, though? Could we be seeing the back of the face mask? Let's find out. We can talk to Professor Koleka Mlisana, co-chairperson of the Ministerial Advisory Committee. Prof, thanks for your time. We appreciate it. Of course, you give advice to the health minister on the way forward. I spoke to the health minister last week, and he says that the health department is making recommendations to cabinet about the way forward to replace the national state of disaster. First question on top of people's mind, are we actually going to get rid of the masks?
Good evening, Eshahana. Good evening to all the viewers, and thank you for having me. Direct answer, not completely. So what do I mean by that? Firstly, we must not forget that the masks, yes, we have seen their impact in preventing, coronavirus 2 infections, but we do know that actually masks also prevent other respiratory infections. So when we're talking about a use of masks for COVID-19, probably it is safe, and I think that's what the data is showing. That's what everybody else is showing, that we will be safe doing away with masks as mandatory for outside gatherings. But at the same time, we are then wanting to move from mandatory to saying use masks for health promotion, for hygiene. If you feel you've got a respiratory tract infection, use a mask. If you feel individually as unsafe when you're getting into the public, you are free to use a mask in the for outdoor gatherings. Now, insofar as indoor gatherings, we are still concerned because we are still seeing community transmissions, and therefore it's wise to actually continue using masks indoors. But at the same time, what also becomes more important is, as we have been saying, becomes ventilation, ensuring that you're in a well-ventilated space. And we will continue to say to people they must really be careful, about moving in crowds or in crowded indoor gatherings. It's rather not safe to be there because we're still seeing, a significant level of transmission, in that even when we're looking at test positivity rates, we really have not managed to get down to below 5, which is what we want. We are still hovering around 6%.
Yeah. So many people will ask this question, and we were discussing this in our newsroom earlier. So let's just say you don't have to wear a mask outside, but you have to wear a mask indoors. The likelihood of you forgetting your mask and not being able to go into a shopping mall, etc., is going to be an issue. But given the immunity of South Africans in terms of the infection rate and now the vaccine rate, is it still not safe for us to drop the masks altogether, according to your scientific research?
It's actually never going to be completely safe, because also it's going to depend on what the level of transmission is sitting at. Yes, we do know that a significant number, I mean, we're estimating around 80% of South Africans have had exposure, either via natural infection or because of vaccination. But we are not, as everybody agrees, we are definitely not where we would like to be insofar as vaccination is concerned. And I think the numbers that you just shared before, I came on, testify to that really we have not even reached 50% of the adult population being fully vaccinated. So we're far from getting to where we would like to be. But at the same time, having said that, therefore there is a level of immunity. But whilst the infections and the transmission is low, it might be okay, but we need to be very careful and make sure that there are mechanisms. Immediately we start to see the increase in cases to be able to get those restrictions back. So it's going to be a matter of where are we in between waves? Are we at the beginning of the wave or not? But otherwise, that's why we're saying when you're outdoors, without a mask, you will still be fine. But when you're indoors, if you want to be safe, rather use a mask then.
Yeah. All right, let's talk about all of the other recommendations regarding the national state of disaster that needs to be re-looked at. What in particular do you think it's time to actually let go of?
Well, I think the issue around the national state of disaster, it really is just going to be a matter of whatever restrictions that are there. When we do away with the disaster state, can those then be transferred to the Health Act, such that then it gives the Department of Health, the minister thereof, an ability for him to be able to say, if we said no masks must be used, when there's a need for masks, then is he going to be able to get those restrictions back as quickly as we need to get them? The same thing would apply when we're seeing the healthcare facilities, overwhelmed by increased number of cases. And therefore, to protect that, can we then go back and say, probably we need to be careful about, high levels of alcohol and injuries out there. How do we then bring those back such that those restrictions can actually be instituted and be instituted urgently as the need arise? So it's going to be a matter of deciding, and obviously, we leave that, to those who understand the regulations and to the politicians at the end of the day. But from where we sit, is for us to monitor the situation, have a very clear recourse should there be a need to reinstitute some of these restrictions.
Got you. Let's talk about the fifth wave. I see Discovery is saying they expect it to be benign and less severe compared to previous waves. So let's talk about the numbers, right? Because you were talking about the infection rate in terms of the percentage. Given how the virus is acting now, that it's less severe than previously, even if we do get a high number of people infected daily, does that mean we need to panic again and actually start more lockdowns or harsher measures, etc.?
Sure.
Can we move away from that?
Yeah. Okay. I think we're really in the process now of wanting to move away from the panic and being able to say, let's make sure that the monitoring is not dropped. There's very close monitoring. We should be able to pick up as the numbers increase. I think there are systems in place now for us to pick that up very early. And once we see the numbers increasing, we've got mechanisms to then have a very close follow-up on the genome sequencing, what is actually circulating. And as we have seen with Omicron, we're very quick, the South African scientists. So we want that to continue. So what therefore is likely, as long as we don't get a nasty variant. I think that's the challenge, really, in that we don't know, should we get another variant, how is it going to behave? But given the level of immunity that's in the general population, and we have seen with the past wave how even though people did get infected, we didn't see severe disease, which is the main purpose of vaccinating. So we're hoping that the same will apply. So as long as we have got close monitoring and we've got efficient and quick turnaround times, we're able to direct and see where we are at, there really should be no reason for panicking.
Yeah, thank you so much for your time and your insight. Appreciate the work you're doing. Professor Koleka Mlisana, co-chairperson of the Ministerial Advisory Committee.